Hello, everyone. Welcome. My name is Natasha, and on behalf of Harvard Bookstore, I am so pleased to introduce this virtual event with Philip Zelikow, Dr. Richard J. Hatchett, and Kendall Hoyt, presenting Lessons from the COVID War, an investigative report by the COVID Crisis Group. Thank you for joining us virtually this evening. Harvard Bookstore's virtual event series continues this season, bringing authors and their work to our community and our digital community. Find our event schedule at harvard.com/events, where you can also sign up for our email newsletter and shop our shelves from home. This evening's discussion will conclude with some time for your questions. If you have a question for our speakers at any time during the talk tonight, click on the Q&A button at the bottom of the screen, and we'll get through as many as time allows. This event also has auto-generated closed captioning available. Depending on the version of Zoom that you're using, you may need to enable captions yourself by clicking on the closed caption button on your screen. You can disable captions there as well. In the chat, I will be posting a link to purchase Lessons from the COVID War on harvard.com. Your purchases make events like tonight's possible and help to ensure the future of a landmark independent bookstore. Thank you all for tuning in and purchasing books from Harvard Bookstore. We sincerely appreciate your support now and always. And finally, as you have no doubt experienced in virtual gatherings, technical issues may arise. If they do, we'll do our best to resolve them as quickly as possible. Thank you all for your patience and understanding. And now I am delighted to introduce tonight's speakers. Philip Zelikow is the White Burkett Miller Professor of History at the University of Virginia, where he has also served as Dean of the Graduate School and Director of the Miller Center. His scholarly work has focused on critical episodes in American and world history. He has been a member of the Defense Policy Board for Defense Secretary Ashton Carter and a member of the board of the Bill and Melinda Gates Foundation. And in 2020, he was elected a member of the American Academy of Diplomacy. Joining him on our digital stage this evening are co-authors Kendall Hoyt and Dr. Richard J. Hatchett. Kendall Hoyt is an assistant professor at the Giesel School of Medicine at Dartmouth and a senior lecturer at the Thayer School of Engineering at Dartmouth College, where she teaches courses on biosecurity, health systems, and technological innovation. She serves on the U.S. COVID Commission Planning Group, has served as a consultant for the Coalition for Epidemic Preparedness Innovations and the Nuclear Threat Initiative, and is the author of Long Shot: Vaccines for National Defense, published by Harvard University Press in 2012. Dr. Richard J. Hatchett is Chief Executive Officer of the Coalition for Epidemic Preparedness Innovations, a global partnership that supports the swift development of and equitable access to new vaccines and other defenses against infectious diseases with epidemic and pandemic potential. Dr. Hatchett's and CEPI's plan is for the world to neutralize those pandemic threats with prescient investment in scientific research and development. Tonight, our speakers will be discussing Lessons from the COVID War by the COVID Crisis Group led by Philip Zelikow. Lessons from the COVID War is plain-spoken and clear-sighted. It cuts through the enormous jumble of information to make some sense of it all and answer, what just happened to us and why? And crucially, how next time could we do better? Because there will be a next time. The COVID War showed Americans that their wondrous scientific knowledge had run far ahead of their organized ability to apply it in practice. Improvising to fight this war, many Americans displayed ingenuity and dedication, but they struggled with systems that made success difficult and failure easy. This book shows how Americans can come together, learn hard truths, build on what worked, and prepare for global emergencies to come. We are so pleased to be hosting this event tonight. The digital podium is yours, Philip Kendall and Dr. Hatchett.
Well, thank you, Natasha, for such a nice introduction. And thanks to the Harvard Bookstore for giving us a chance to talk about this new book. By the way, the book looks like this. Beautiful blue cover. If you go by the Harvard Bookstore and spot that sky blue, you know what to buy. So this is an odd book, really. It's got 34 co-authors. And you're entitled to a little bit of an explanation as to how this thing came into existence. We were originally supposed to help plan a national COVID commission. Several foundations asked me to run an effort to prepare the way for a huge national commission that would investigate and understand the biggest crisis to hit the United States since the Second World War, if you measure it by lives lost and money spent. So we gathered this enormous group of 34 people, outstanding people, including Kendall and Richard and 31 others. We we held listening sessions with hundreds of people. We formed task forces and did a lot of work. And then we realized last year, you know what? There's not going to be a national COVID commission for various reasons in the Congress and in the executive branch. And so we could either pack up all our insights and go home. And we held town meetings among the group to decide what to do. And the group members basically said, well, I think we now need to just tell people what we know. And the result of deciding to just tell people what we figured out is this book. So this is I think the only available account right now that in plain English goes through all the key choices made in this crisis, from origins to Operation Warp Speed and everything in between. It's I think there's no way anyone would read this report without feeling like they can now make a little better sense of what happened to them, as well as to their country and indeed a lot of the world. There are a lot of, one of the things that I'm often asked is, okay, what's the big takeaway from this report? And the big takeaway from this report is not about follow the science. It's really about getting ready for a great emergency. It's about preparedness. What does preparedness mean? In general, it means knowing what to do in an emergency and being ready to do it. If you want to see what preparedness really meant in practice in this crisis, which doesn't fit neatly under red or blue partisan labels, when you read this book, it'll just be obvious to you what preparedness means. It'll be obvious to you what it meant to be unready, but also you'll see all sorts of terrific improvisations that were done during the crisis, including some led actually by Richard, that inspire us with kind of a lot of low-hanging fruit that could help us be much more prepared for the great emergency next time. So the first key theme is preparedness. A lot of people also say, well, they present us with their standard blame narratives. And there's a blame narrative on the Republican side that, well, let's just blame China, or let's just blame the public health experts, for which Tony Fauci becomes the poster child. Or on the Democratic side, let's blame President Trump. The irony of blaming the public health system, I was asked about this recently, is did the public health system and did public health leaders fail? Well, they were set up to fail. We came into a 21st century national pandemic with a system designed in the 19th century. At the time this pandemic hit us, we were set up to fail. So should we then blame those leaders for the failure? That seems somewhat unfair. As for President Trump, anyone reading this book will conclude, as we did, that he was at the least a comorbidity, a pre-existing condition that increases the risk of death or serious illness. And no one reading this book would come away from it believing that President Trump should be anywhere near the instruments of government anytime soon. But if you think that the crisis and what happened in our country was all about President Trump, you actually miss a lot of what actually happened in the crisis and a lot of the reasons we failed. A crucial conclusion of the book is that the polarization and toxic politics were fed by our lack of preparedness. Very quickly, it became obvious a lot of people were ready to take guidance on what to do, and we didn't have really good guidance to give them. We were flying blind in tracking the progress of the pandemic. We didn't have good toolkits to fight it. And into that void of not knowing what to do and the flailing and the floundering, into that void, toxic politics could then just flow in. And that started happening all through 2020 and just kept getting worse and worse. And then you see that story unfold through the report with all kinds of insights in which lots of people were trying to do the best they could in a system that made success hard and failure easy. So what I'd like to do now is, having just introduced a little bit of what we were up to and what this report was about, I want to turn to Kendall first to answer a couple of questions and then turn the conversation to Richard. And the two things that I want Kendall to take on is first, how you handle the private sector in a giant emergency. The public sector obviously didn't have the capabilities to respond at scale in this situation. You had to therefore form some kind of partnership with the private sector. So, and Kendall has particularly looked at this public-private nexus, and I'd like to hear again some of her insights about this. And then secondly, I'd like her to reflect a little bit about whether or not we need to get ready for health security in the ways we sometimes get ready for problems of national security. So Kendall, over to you.
You've never been one for easy questions. I think an important point, when it comes to working with the private sector, to realize is that this is a team effort. Government can't do this without industry. Industry can't do this without government. And I think importantly, as Richard will tell us, no one country can do this without other countries. And that's a huge part of it, which I'll talk about a little bit too. But when it comes to working with industry, I mean, that's a form of preparedness too. So preparedness is really about what are we doing right now? And if we are not sitting down at the table with companies in this moment of relative calm to figure out how we are going to develop the next generation of medical countermeasures for COVID or for something else, then we've already failed to understand the lesson of this pandemic, right? And we need pre-existing partnerships to move quickly. And I mean, this is the lesson of CEPI. This is the brilliance of Richard and what he's done at CEPI. They were able to initiate.
The CEPI, by the way, is the acronym CEPI, the Coalition for Epidemic Preparedness Innovation. And everyone will get a quiz on whether they can say that quickly. That's CEPI.
That is
I can't even say it quickly, Philip.
Well, I think CEPI is one of doing incredible work, a really remarkable and visionary organization. And I'm going to blame Richard for a portion of that. But they were able to initiate and redirect contracts just 13 days after a Chinese scientist posted the sequence for SARS-CoV-2. And we should talk a little bit about how they do that, because it's different from how we do it in the US. They have a very proactive and strategic stance, whereas we tend to be a little bit more transactional and reactive, and it does not put us in a position to move as quickly as CEPI was able to. So I think that's very important. Your second question was about treating this as a security issue. And I think it's one of the reasons we say that, one of the reasons we call it a national security issue is because we need to, it's a useful analogy, especially when you're talking about development and procurement. And we need to be able to procure in parallel, with multiple pre-existing relationships in order to have the speed and the scale that we need in an emergency. But, unlike in a traditional war, we really, in a fast-moving pandemic, I'd say we're really in a race against time and not against each other. So it's a collective security problem in that regard. And so some of the best solutions available to us are collective as well. There are many different ways of thinking about this where it's not a zero-sum game necessarily, or it doesn't have to be a zero-sum game. So, think about how we procure vaccines. Public funders have more leverage to shape the market for public goods, such as vaccines, when they work together. And when you can build the mechanisms and the tools that allow you to do that, you have a bigger pot of money, so you can inspire more innovation, have more diversity, reduce your risk, but you can also determine the terms on which you distribute that good. So you can distribute on the basis of need. You can deliver the vaccines where it's most likely to end transmission. And, you can do it as opposed to having it go to the highest bidder, which is what happens when you just have nations competing, high income nations competing. And when it goes to the highest bidder, it drives up the cost and it reduces access and everyone loses. So to the extent that we can search for collective solutions, I think that would be, use the security mindset where it helps you and then depart from it when it doesn't, would be my answer to that.
So in the last part of your answer and your comments, Kendall, you opened up the issue of thinking about this as a global war. Because these health emergencies, these kinds of 21st century problems were global. And all of us are very practical about the pressure from national governments and national citizens. So none of us think we're living in utopia. We're all working in the real world. But Richard really was, because he was running this organization that was kind of the global vaccine finder, kind of this unusual nonprofit organization based in Europe. And when this pandemic broke, so he had the job of being the global vaccine finder for this pandemic and testing whether his organization was ready. So Richard, I want you to comment on two things. I want you to comment, first of all, like, how should we understand the meaning of a global war? This is a global struggle. What's important about that, as strategically? And the second then is, all right, then what are some of your insights into what it would mean for preparedness, this theme of preparedness, for us to try to be prepared globally? Over to you.
Great. First, let me thank Natasha and the Harvard Bookstore for having us. Harvard Bookstore is one of my favorite bookstores in the U.S., so it's really an honor to join you this evening. And Philip and Kendall, thank you for the kind remarks about CEPI, which is, it's an output of the people within CEPI, and I just have the privilege of leading it. So just a little bit of background for those of you who may not be familiar with CEPI. It's a relatively new organization, which is hopefully why not so many people had heard of it when the pandemic started, but it was set up in 2017 as a result of the Ebola epidemic in West Africa. It was probably the major sort of policy innovation coming out of the Ebola epidemic in West Africa. And the idea behind setting it up was that ultimately a vaccine was deployed into West Africa at the very tail end of the epidemic, after it had been brought under control with traditional public health interventions, but after 27,000 infections and more than 11,000 deaths. And an estimated $53 billion of impact on the global economy. And I think global health leaders were shocked and dismayed that a vaccine that was ultimately shown to be 100% effective was not ready to be deployed when it was needed. And it had languished in laboratories, making slow progress for well over a decade. And so CEPI was created to address neglected epidemic diseases and to accelerate vaccine development. And then, of course, COVID happened after we had been operating for a little less than 3 years. And thinking about the COVID problem, I mean, a pandemic is inherently a global issue. Pandemics, diseases obviously don't respect boundaries. They move very, very quickly. They seed around the world, and then they tend to affect almost, simultaneously regions of the world, many countries around the world. And so thinking about, a pandemic is an inherently transnational problem. And the ideal circumstance would be to contain an incipient pandemic at the source. But to do that, most countries don't have the capability to do that by themselves. They will need help. There are significant disincentives for countries to report outbreaks because they are afraid of the consequences of reporting outbreaks in terms of travel restrictions and border closures and being cut off from trade and travel. And I think, we now recognize that there were delays in communications out of China about the seriousness of the situation in Wuhan, and even some delays, and we talk about that in the book, in terms of releasing information about the nature of the pathogen. And those delays provided time for the virus to spread and for its geographic diffusion to the point at which, by the time China really geared up with the dramatic interventions in the middle of January 2020, the opportunity for containment globally probably had been lost. China, using an incredible set of interventions, was able to contain it within China, but the genie was out of the bottle, and we saw the rapid escalation of the epidemic around the world. Different countries responded using different tactics to early cases, and I think it's important for American audiences to really understand the ways in which the American public health system and the American response let the country down, because other countries like South Korea, other large countries, South Korea, Japan, Singapore is a small country, but Singapore, New Zealand, Australia responded differently than the US. Most of the countries emphasized early rapid deployment of diagnostics with aggressive testing and tracing campaigns. That's what happened in South Korea and in Japan. Implementation of non-pharmaceutical interventions, but not necessarily mandatory closures. The widespread use of masks in Japan. Japan has the oldest population in the world and the lowest death rate among countries of the G7. I think the death rate in Japan is somewhere, a third or less than that of in US and the UK. So there is a lot to learn at looking at the different national experiences with the virus, particularly early in the pandemic, and the way populations responded. In terms of insights for preparedness, and maybe that kind of leads into the insights for preparedness, I do think a comparative review of the way different countries responded, and particularly the behavioral response of populations in different countries, will be really important to understanding the differential outcomes that we've seen. One of the things that I'm seeing sitting in an international organization, talking to different countries, different regions that are thinking about preparedness now, one big important lesson is that because of the inequities of access to medical countermeasures, the regions that suffered from lack of access, particularly in Africa, but also in other parts of the global South, South America, parts of South Asia, Southeast Asia, are now committed to developing regional capacities for production and scaling of countermeasures. That I think is a good thing, because I don't think we'll ever be able to overcome the responses of politicians, national politicians, who have to take care of their own populations. I mean, that is just an ineluctable outcome of a threat like a pandemic. There's also particularly across the high income countries, the countries that are in the G7, the countries in the G20, they're going to be massive levels of resources that are now poured into pandemic preparedness, usually through national mechanisms to address national security needs. But collectively, those resources that are poured into national, or in some cases, regional mechanisms, and to a certain extent into international mechanisms like CEPI and some of our sister organizations. Collectively, that investment in preparedness, if there is a degree of, I'd say, light coordination, provides a foundation for creating a global capability to respond to future threats. And one of the silver linings, I suppose, if there was one, to the pandemic was the rapid advances in different technologies and the proof of concept for how those technologies might be used, either for diagnostic purposes, for surveillance purposes. Wastewater surveillance, I think, it has become a thing because of the pandemic. mRNA technology, probably its validation was accelerated perhaps by as much as a decade because of the pandemic response. So we're emerging from the pandemic with an amazing set of tools, an unprecedented level of global investment in pandemic preparedness and in new technologies and new tools, and an opportunity, if we choose to take it. And I think that's the point of the book that we have contributed to, is to lay out that experience very clearly, so that the failures and the successes are recognized and understood in the interest of taking advantage of these opportunities that we have while this experience is still salient and searing, to make a set of reforms and institutional changes that would allow us to respond more effectively in the future.
So I want to just first take notice of what both of you are saying. Kendall is saying we've actually learned quite a lot from the crisis about how to work with private industry to get ready for another emergency, if only we'll absorb those lessons. And then Richard, in turn, has said that actually the crisis has shown a lot of new technological capabilities, a lot of new tools. So between learning better about how to work with industry and then the opportunity to exploit these new tools, there is a lot of real potential here to do this if we have the system to do it. So the report itself talked a lot about our system. It made the point, for example, that if you compare us with affluent countries, similarly affluent countries in Europe, the United States system did much worse. Our 300 plus million did much worse than their 300 plus million at every stage of the crisis. People have these images of, say, super modern countries like Germany or Norway. But if you were to compare, say, the state of Florida with the state of Spain, Spain excess mortality rates were 50% lower than Florida's on an age-adjusted basis. And a lot of that, you can get similar numbers in all sorts of comparisons with Italy or others, because a lot of the differences are just deep differences in the institutions. We went into this crisis in a situation where we thought we had a national public health agency called the CDC, and the CDC sometimes thought of itself as a public health agency. But as we explain in the report, we have no national public health agency in America, not really. The CDC has no executive or operational authority around the country and has no particular reservoirs of staff to meet a national emergency. There's, we went into this war without an army or a battle plan. So then you have a situation where the public health system and its data is completely detached from the healthcare system and its data, which is completely detached from the biopharma industrial complex and its war-winning weapons, and no one in Washington who is trying to kind of write the script for all this and offer and conduct the orchestra. Another analogy some of our doctors use is you have all these specialists crowding around the patient, but there's no one who's the attending physician, who's responsible for the overall coordination of care. And to this day, we still haven't really clarified who is the attending physician among all the specialists. But these are things our government can fix. And in a way, the purpose of our report was to show people that they can be fixed. And so people don't come away from this kind of feeling discouraged and hopeless. We also took on the origins issues and offer a pretty good account of all the respective theories, and we don't come down hard either way because we don't think the evidence is there yet. But we say there's a very clear agenda for the future in trying to track outbreaks overseas, but also in trying to regulate and better get a handle on these new risky frontiers of biological research, where the crisis has certainly called out to a lot of people some of the potential dangers. And you'll find, I think, a pretty forward-looking discussion of that in the report. I wanted to come back a little bit to you, Kendall, because there's been a lot of discussion of the role of the biopharma industry in the crisis. And I want to just ask you kind of a general question of, should we view the biopharma industry, the drug industry, as villains? Do you kind of think of them as sort of evil multinational corporations? I mean, you've worked on this problem. I mean, just share us a little bit as like, how do you want us to think about these behemoths?
I mean, as I said, the government can't do it without industry, and industry can't do it without government. It's an absolute team effort, and both parties need to do the best they can to help the other succeed. I think, one of the ways that, I mean, you mentioned, why did America fare so badly? I don't know that that's necessarily industry's fault. I wouldn't say that, but what it does point to is that we don't have a great way of knowing if we're prepared. We don't have a good measure or metric for preparedness. So, I mean, on the health security index, the US ranked really high for the ability to detect and respond to novel outbreaks. On paper, we looked great, but we did not have a great way to test and evaluate some of those capabilities. So, I mean, one capability that would make a huge difference is one that Richard talks about, is the ability to develop a new drug to a novel outbreak or vaccine in 100 days. That's the difference between an outbreak and a pandemic. That's the difference between, $100 million and $16 trillion, and, 100 million, who knows how many million lives. So that's a worthwhile investment. And that's something you do with industry and government, because the market doesn't call for that. There's no market incentive to be able to do that in 100 days. Why would you build a drug for a disease that might disappear, or that almost certainly will disappear if you develop the drug for it? So, that has to be done with government. And we should build this capability, and we should test it, and we should evaluate it, and we should do it every year. And maybe for a novel outbreak, but maybe for a disease that has a high disease burden. That's how you know if you can do it. And then you've really developed an innovation and a public asset public good that actually will ultimately help industry.
Richard, let me ask you kind of a tough question. I mean, obviously, there's a lot of worries about our relations with China, about China's role in this crisis or lack of role in this crisis. The fact that China was clearly, I think, by all accounts, slow in providing information to the world about what was going on, about giving the world early access to physical virus samples that would allow us to help produce really good tests before cases showed up on our own shores, all of that. So as you think about the challenge also ahead, and we discussed some of this in the book, talk a little bit about, should we give up on international cooperation because of the divisions we have in the world today? I mean, you spend some time in Asia. Are they giving up on international cooperation?
I would like to think, Philip, it's an important question. I would like to think that there would be areas where collaboration is possible even while other geopolitical conflicts are being worked out. I have often talked about the fact that Russia, or the USSR, and the United States collaborated to eradicate smallpox, even at the height of the Cold War when they were fighting proxy wars in other locations. They
Great
worked
point.
together to eradicate smallpox, and the disease transcended the geopolitical conflict of the day, which was a pretty sharp conflict. And it's incredibly disappointing that China and the United States and Europe were not able to better coordinate their independent efforts to develop countermeasures and to distribute countermeasures, and that countermeasures became instruments of geopolitics during the crisis, unfortunately. COVAX, the effort that we helped set up with Gavi and WHO.
Take a minute and explain what COVAX was.
Sure. I mean, COVAX was an effort to create a fair allocation mechanism for vaccines, and it was set up early in the pandemic with the goal of distributing vaccines to make sure that they were allocated to countries irrespective of national wealth, and that the countries, we anticipated that vaccines would be scarce for much longer than they were. Actually, the scaling up of vaccines during the response over the first couple of years was absolutely unprecedented. But it was very clear that there were segments of the population that were much more vulnerable to bad outcomes from the disease than other segments of the population. And the efficient allocation of vaccines would save more lives and so we tried to set up a mechanism to do that. And we also set up the mechanism at a time when it was not at all clear that any of the novel approaches that were being used would actually work or not. And there's a really interesting history, which I think is an important proof of concept for thinking about preparedness for future viral threats, as to why so many of the vaccines didn't work, but we didn't know that at the time. And so COVAX was set up to invest in an R&D portfolio, a large R&D portfolio, and to allow for early advanced purchase of those vaccines, and then through a fair allocation mechanism. And it fell short of its aspirations for a number of reasons, which probably more than one talk about right now. But I would just say that in terms of the institutional response, I'm deviating from your question, unfortunately, because I can't really remember what the question was.
It was about China. It was about can we cooperate without China?
Let me come. I'll come back to that. The point about the institutional responses is there were some institutional novelties that didn't work perfectly. Even Operation Warp Speed didn't work perfectly, but Operation Warp Speed, COVAX, something called the ACT Accelerator, that probably should be institutionalized. I mean, I think we've had our Bretton Woods moment with respect to pandemic diseases, and now we need to have a period of institutional reform. China, coming back to China, thanks for the reminder, has tremendous scientific capability, tremendous industrial capability. They actually authorized their first vaccines in August of 2020. They had a different regulatory theory. They treated the platforms that they were using, the inactivated vaccines, as essentially well understood, and only required phase 1 and phase 2 testing of the vaccines before authorizing them, emergency authorization, even while they required the continued performance of efficacy trials even after the authorization. So they rolled out their vaccines earlier actually than we did in the West. And I think we can disagree with how they defined a well-characterized platform, but the regulatory theory that they used is one that we should study closely, for example. And so there should be collaborations. It's in everyone's interest that information exchange and information about outbreaks and new pathogens be shared and shared rapidly. And it is profoundly short-sighted, even with the controversies about origins and controversies about who did what when and who should have shared information. It's profoundly short-sighted to let our current geopolitical situation prevent scientific collaborations that have been ongoing for quite some time and would continue naturally absent political interventions.
So I want to turn the floor in a moment over to Natasha to moderate some questions that we may have. But I want to stress that although we haven't spent a lot of time on it in this webinar, the book spends a lot of time on the state and local response. It spends a lot of time on issues like school closures. It talks a lot about the struggle of our healthcare system and our doctors and our nurses. It talks a lot about issues of communication in a crisis and disinformation. So there are a lot of topics that we haven't gone into in depth tonight, and I just want to be sure that viewers know that our report thinks those issues are important too. So Natasha, over to you.
Thank you so much, Philip. So there are quite a few questions right here. I'm going to stick with one of them because I am also kind of curious. It's about the latest COVID booster shot and why, and I guess this is kind of going forward, why didn't that have some of the latest variants is how this question is asking. I'm just wondering sort of what's our plan going forward for the boosters?
All right, so this is a jump ball for both Richard and Kendall, but especially Richard. And
It would be the actual doctor in the room.
Yes, because you need to both talk about the currently available vaccine, and if you want to, you can dispense public health advice as to whether people should take it, even if they've already had some shots. But I think Natasha is also kind of asking you to sort of forecast the rhythm of how this is going to unfold in the future.
Well, it is very difficult to forecast with any degree of confidence given the way the virus has behaved to date. But what we have seen with the vaccines that we have, even the original vaccines, now the updated vaccines, the bivalent vaccines, is the protection they offer against infection is transient, but the infection that they offer against severe disease and death, the protection against severe disease and death is robust and enduring, and that's encouraging. The virus is evolving rapidly, but I mean, it is also infected probably at this point 6 or 7 billion people. So it's had lots of opportunities to evolve and lots of, variable immune pressure from populations that have either been naturally infected or exposed to vaccines that is, creating pressure on the virus to adapt in the presence of significant human immune responses at this point. And so we have seen the emergence of new variants that have caused significant increases in transmission and significant increases in death rates. The death rates, fortunately, are coming down. We hope they will stay down. You cannot predict with certainty how the virus is going to evolve. And viruses that have very low death rates, the selective pressure caused by a doubling or a tripling or a quintupling of the death rate by a random mutation, perhaps, is not going to be very strong, right? If you go from 0.2% to 1%, it's going to take a long time with a virus where, there's only a 1% mortality for that higher mortality to be detrimental to the spread of the virus. So as well as we can tell right now, based on the science that we have.
In other words, what Richard is saying is the virus can kill 1% of its hosts and still live happily ever after.
Yes, still transmit happily ever after. I mean, I think the short answer is, for the time being, I think if and when the vaccines are updated, particularly if you're in a group that is inherently at higher risk of bad outcomes, getting that vaccine makes sense. But there is still quite a bit that we have to learn about the virus and how it interacts with the human immune response. The vaccines very clearly offer the best protection from severe disease that we have currently. And it's hard to predict the direction that the virus is going to go in the future. I would just say very quickly, one of the things that we're doing, one of the things that the National Institute for Allergy and Infectious Disease is doing, and this has been highlighted by Project NextGen that was recently announced, is thinking about, can we develop, through design, deliberately designed vaccines that are broadly protective against, a wide array of coronaviruses, and they kind of take the rapid mutation of the virus, the threat that poses, off the table. And we're making progress. It's going to be a while before we deliver wholly new vaccines. The vaccines that we've got, though, right now are very effective.
Thank you so much for that answer, Dr. Hatchett. I've got another question here from Patricia. Out of all these reports with lessons learned, what will really be enacted the next time with such a divided country? It's a tough one. Well,
I'll take that one on. Because of course, the honest answer is we don't know. We're running an experiment. We've now provided a report that I think, to a degree others do not, provides actually a pretty practical guide of a lot of things to do. It's not like the government already knows these things and is not acting on them. The government internally has not done this kind of after-action report. So our report now is available at all levels of government. And as that gets absorbed, there's no way anyone can read this report and have it not affect their behavior and their outlook. I promise. So as that happens, how are people going to react to that? I will say right now, mostly before the report came out, mostly the sense was an impatience to turn the page and move on and talk about other things. The reason we rushed to get our report out when we did is because we thought the window in which you can get people to stop and think about these lessons, that window was closing. And if we didn't get our report out, that window might close and then only academics would want to read about this. So now our report is out. A number of people are talking about it, which is terrific. And now we'll see. The good news is that a lot of really good stuff can be done without the whole country coming together and solving all our divisions. So this is not, you don't have to have a utopian fantasy in which the drums beat and the flutes play and Democrats and Republicans join hands and dogs and cats live together. And no, that doesn't all that does not have to happen. Really, there are all sorts of things that can be done at all levels of government, and including in the private sector, as people absorb a lot of different lessons from this report. I'm already hearing about initiatives that some people are planning, inspired by our report, on some of the data issues, on things like best practices in hospital systems. So it's discouraging that more people are treating this pandemic fatalistically and assuming that nothing can be done. But I think it's too soon to give up.
If I can add something, Philip is really extraordinary at synthesizing and making the complicated simple, which is what he's done in this report. And it shapes our common understanding of what we all came out of the fog of war. Like, what do you make of that? And he's clarified a lot of these lessons. And whether that goes into one specific government initiative or not is almost beside the point sometimes, because if we, when you have a common understanding, then we're all pulling on the same oar, to affect change, at all different levels of government and civil society. And I think this report really contributes to that effort.
If I could just build on what Kendall is saying, the report does a lot of what I think we would call sense making, and it does it through very succinctly telling the story from the inside on a number of issues. So it actually adds to the historical record through the interviews that were done. Talk to people on there was not a partisan, direction of who we were interviewing. We were interviewing the people who were inside, seeing what happened and understanding why things happened in the way that they did has to be the foundation for thinking about how we can improve outcomes in the future.
Thank you so much to all of you for that much more hopeful answer. I appreciate that. It looks like we have a couple of minutes. I've got a question myself, if you don't mind. I am curious about the title that you chose for the book. Calling it The COVID War is interesting, especially because I don't feel like in the midst of the pandemic, it was really referred to as a war, at least not amongst my peers. And so I'm curious why that's the title that was chosen.
It's a great point. There are people in healthcare who don't like the war analogies, but there are a number of members of our group who really do like the war analogies. And here's why. It's kind of like people didn't understand that we had to muster the national action that you would muster in wartime. You kind of have to get in a wartime mentality. This thing was killing thousands of people a day. It cost us, we spent $5 trillion. So because you don't get in a wartime mentality, you don't act fast, and you don't develop warlike plans with the right sense of urgency and bringing together the people to act. And that's the spirit that we wanted to animate by choosing that title. Richard has been especially eloquent in kind of stressing that when you get a situation like this, every day counts. This is literally, economists sometimes write, this is one of those rare cases where you spend billions to save trillions. That's actually not hyperbole. You can compare vaccination programs, and literally, it's billions of dollars a day for every single day that you delay the development of medicines and vaccines. So you begin to get this sense of, you know what, if you if we were acting like we were going to war against this thing, we would have done a whole lot better.
I would just say that probably the biggest single success of the U.S. response, in my mind, was Operation Warp Speed, and it was the one aspect of the response that Kendall has studied vaccine development in the Department of Defense, but it was one aspect of the response where I think we did engage a approach that was comparable to how we resourced and provided logistics support in our other war experiences.
And it was run mainly by the Department of Defense. And so partly what Kendall is stressing is, if you wait till the war is already broken out before you start getting ready for it, you're going to lose that precious time, and a great many people will die and sicken unnecessarily. So you've got to adopt this national security mindset in peacetime to be able to get ready for the war. If we only think of aliens that can attack us, and terrorists that might kill a few hundred people, and we miss the microorganisms that can kill millions, we're making a big mistake in the way we define security.
Thank you so much for that answer. I think that we have made it through all of our questions for tonight. So I just want to thank you all once again for this fascinating conversation. I've learned a lot. I'm sure that everyone here has. Do any of you have any final words before I do a little outro and end this webinar for tonight?
I would say one thing, which is that we need
Go for
to prepare for the next pandemic as if it's really coming, because it is.
And everyone should buy the book so that they can learn about COVID and be prepared. There is a link in the chat for anyone interested in buying the book. It's also on our website at harvard.com. I just want to thank everyone here for spending your evening or whatever time of day with us on behalf of Harvard Bookstore here in Cambridge, Massachusetts. Please keep reading and be well. And a good night to everyone. Thank you all so much.
Thank
Thank
you.
you, Tasha.
Bye-bye.
Bye.